ndahura nshemererwe.
The goal of the AIM Health project is to reduce both maternal mortality and infant mortality by 25% by the end of the 5-year project, 2015.
World Vision Uganda, through North Ruchiga ADP, Kabale Cluster, Busitema and Lunyo ADP's Busia Cluster, is implementing a 5-year maternal newborn child health project, AIM Health Project, with the goal of reducing maternal and infant mortality by 25% by December 2015.
The AIM project is targeting women and children, and it was developed together with the Ministry of Health through the Office of Health Promotion and Education. And the whole aim was to use the community, the district structures, support them, strengthen them to address issues of maternal and child health.
AIM Health has worked very hard to strengthen community health structures. We are working with community health workers and village health teams and basically giving them the skills to be able to provide women and their families with information that empowers them to know exactly how they can protect their children from diseases and also how they can access health services.
We as Kabale districts appreciate the support given to us by World Vision because the right diagnosis was made. The diagnosis to engage the community to address maternal and child health issues. That was the missing link.
The project registered huge success, especially in the involvement of Ministry of Health in project curriculum adaptation, building the capacity of lower-level cadres in the health centers, motivating, training and equipping the lower-level community health structures. The case in point are the village health teams, VHTs.
World Vision kuyayizire ekatutamu kugira ngo twabugana nkaba mushanju batwegesa niko twagaruke nyuma twayegesa abantu bona VHTs 35 umwuga gwampa.
My role as a VHT is to mobilize pregnant mothers to go for antenatal, and I make sure I follow them up to see that they have had ANC1, ANC2, ANC4.
In my village, as a VHT, they elected us to sensitize about sanitation and hygiene.
I always mobilize lactating mother take a child for immunization, to keep the baby clean and to keep her home clean, to breastfeed the child exclusively without giving anything or water until the baby is 6 months.
Kareho omukazi ko yabaga yinenda amanya ngo arayika kuzara atakagire mu irwari konko bwa hati ba VSP bakegesa twamanya ngo omukazi yagirenda ashemere kuza mu irwariro hamyeze 3 yamara kuza mu irwariro akeberwe atungo buhereza nk'emimbazi yo kumulinda kandi agumizemo araza mu irwariro aragenda no mushija weye kugira ngo no mushija ayegesibwe atunge okumanya ngo omukazi cyarabaletenga akibone.
Under access to infant and maternal health, we have what we call PD health, which we are carrying out in the north now. PD health is a positive deviance health. That is a program that is responsible for rehabilitating children who are malnourished. We go to the village, we assess the children who are there, 5 years and below. So we call parents, we tell them what to do, they bring the food, we show them how to prepare the food, a mixture. Should be a food which has all the components, carbohydrates there, proteins there, vitamins there, all the components. If the child is still malnourished, we will refer to the center for the rotifers or for rehabilitation.
Namanya nti wateka nkemondi okagaburo ngano teme bimba nturawama wayaje ngeno butiya tukashangara okuteka mondo katame bihimba okatamudodo okatamu nankeze sano yeburo okatamu mugusha okateka okashota ndio nakajya kandi akamagara marunza kagatunga yatunze mu bibiri sabikanye muno.
When it comes to CVA, we have engaged the service providers and all of these the stakeholders at all levels, at community level, at sub-county level, and even at the district, where we had very powerful and fruitful district health dialogues.
CVR has managed to train people in Busitema to identify their own problems, and that one has been achieved properly well. Also, CVR has managed to educate and sensitize people, the wananchi, on how to advocate and lobby for themselves in this sub-county. So far, we have carried out a community gathering activity which has done very well, more especially on the side of health. We are doing very well. All the problems and gaps which we identified, we have already sent to the high authority for those problems to be solved.
Less than half of all pregnant women attended the recommended 4 antenatal visits, and most waited until they were 4 or 5 months pregnant before initiating care.
In health facilities, under AIM project, they have trained our health workers on maternal and child health, and the health workers are now giving improved services to save the lives of the mothers.
We used to not have very many mothers attending antenatal, but we have seen a great change whereby we have engaged VHTs for mobilization from the field down there in the villages. Now we have dramatically improved on the numbers of antenatal, and we have had some improvement in maternity, because before we never used to have deliveries, but now, as per now, we have an average of 5 mothers delivering in a month.
At first, before World Vision came to contribute to us what we were doing, they brought for us mama kits, and those mama kits pulled many mothers to this health facility. Like at first, we used to deliver 15 monthly. The maximum would be 20. But these days, after World Vision came in, we are delivering 30 to 40 and sometimes 45 mothers delivering from this unit.
Ubuhereza ubu nabwene ni burungi abazarizi hakubanga banza ntayikire anuye banteraho uburyo banzazaje nanye nazaraje nyineya bandeberere nko kukira basa ndahura nshemerigwe nabwo kurera bampaka kantu nanye karaza kunyamba mwana wanje.
Most of the mothers were being delivered by TBS at the village level, but with the help of AIM, they had to call the TBS to sit with us on a dialogue meeting, but at least now, all those TBS are referring mothers to the health center, and we are having an average at least of 50 mothers per month.
I want to thank World Vision, most especially AIM project, that has changed lives in the communities where it is serving, that is North Ruchiga, the sub-counties of Wamchuchu and Kashambia.
I think we have never lost any mother from this facility. So maternal rate, we are at 0%. Then infant mortality, we are also at 0%.
We don't have water. Mothers go back when they have not bathed because the health unit does not have water. Our building is soon collapsing. Sometimes mothers fail to deliver from near Ram Health Center too, because when they see the crack, they know when it rains, the building will sweep them away.
The labor room is small and dark.
We do not have the ambulance to refer mothers who fail to deliver from the health unit. The power to the health unit, we use solar and sometimes it gets off.
We have issues, challenges relating to staffing in the health facilities. Staffing is very low. We have challenges related to medicines and medical supplies, and also we have challenges relating to basic infrastructure and equipment in the health facilities.
First of all, we have to mobilize people from very far distant places, and we are not facilitated on those areas.
What could be the challenge is now, how as a project are we going to look at serving the ever-increasing demand for health services at health centers.
Nicho turi kusimira aba World Vision kureba ngo bahe emikono kandi nabwo he n'obuntu buke obu bari gukora kubayamba.